HIV has never been cured. You may not be that aware of it anymore because people are being treated and they're not showing up with symptoms around you, and Hollywood's not making movies. But there's 1 million people that are infected in the US, more than 1 million, and they're suffering. They're suffering because they have to take a poison pill, basically an antiretroviral that is a mild chemotherapeutic every single day to control the virus. It's critically important to actually find a cure for HIV because these folks are suffering daily consequences of taking those pills, of things like nausea, diarrhea, fatigue, headaches. But long term, the cost of maintaining these patients is tremendously high because of early aging, bone density issues, osteoporosis, brittle bones, liver, kidney, heart disease, and extra cancers. At AGT, we think that curing HIV is possible, and we are actually in a phase 1 clinical trial with a cell therapy that will convert an HIV positive individual into permanently immune to HIV, a one and done cell therapy. We draw a leukopak from the patient, we put it into processing, it makes a cell product, we put it back into the patient. Vein to vein should be approximately a month, and after that, they should be functionally cured. Never able to infect anybody else, never able to get AIDS, and never ever able to recontract HIV. That's the amazing thing. HIV would be out of their lives forever. There would be no danger to anybody around them, and they would be living a normal life without all those side effects of that toxic chemotherapy. When do we think we might be able to get this done? Well, in summer, we think we will be able to start to announce safety data. Why is that? We're already 5 patients in the first cohort of 6 patients enrolled in the study. We will be reinfusing the first cell product, we believe, in late April, early May, and then we should be able to report the safety data very quickly because it's an open label study. Everybody in the study is HIV positive. So we'll have some safety data for you this summer. And then by the year end, we should be able to show efficacy signal. Now, what would that efficacy signal look like? Well, we think that we can get markers from their blood that show that this is working, but it may even be as good as people getting off their antiretrovirals. The study doesn't require them to get off their antiretrovirals, but they could do that on their own if they wish. If they do go off their antiretrovirals, normal viral rebound to full viremia is 21 days. So we would know 21 days after they go off of their antiretrovirals whether this one and done therapy is suppressing the virus on its own. So that would be a very exciting finding. I think there's a reasonable chance that somebody will choose to do that, but if not, we will have data that is convincing to scientists in its place. There will be measurements of the blood that show that this product is working. Obviously, this would be huge. Curing HIV, there are 37 million people worldwide that are infected. There are 1.2 million approximately in the United States. There's probably 4 to 5 million insured worldwide that have HIV. And so this is, a game changer if we can do it. And I'll be honest with you, I am quite confident that we can do it. I think we're going to do it in this study, but we know that we have something that is likely to be efficacious, and we also know lots of ways to tweak this if we needed to bug it and make it even better.